2013 Human Services Committee meeting to order. Looking for an approval for the agenda.
Support.
Motion and support. Are there any changes or amendments? All in favor?
Aye.
All right. Next up is public comment. Is there any public that would like to make a comment? Seeing none, we'll move on to committee meeting items. We have the minutes of our July 15th Human Services Committee meeting.
Support.
Motion and support to accept those minutes as printed. All in favor?
Aye.
All opposed? Next up, we have the Health Department. Mr. Toon, looks like you have got a handful of things to share with us.
Good morning.
Good morning.
We have a couple items on the agenda asked for your approval today. One is a contract extension for the Jackson County Health Plan. I think we've provided a good amount of information for you on what that relationship is, and this is a request for an extension of the existing agreement from October 1st through the end of this year. And the primary reason for the shortness of that extension is that the health plan wants to make sure they understand what's happening with Medicaid expansion in the state. They don't want to overextend or potentially match resources with the resources we have available for the federal Medicaid in the event that there are changes in the state Medicaid plan that would affect that plan.
So with that being said, if Medicaid expansion is passed here in the near future, the way this stands right now, no amendments would have to be made?
Yeah, we wouldn't have to make any amendments, I don't think, this year. Something would probably have to happen, next year.
Thank you.
Yep.
All right, so we are looking for a motion to authorize the First Amendment to the agreement for services between Jackson County Health Plan Corporation and Jackson County Health Department for the period of October 2013 to December 2013, and also to authorize the health officer to sign the agreement. We have motion and support, and this will move on to the full board.
Thank you.
Thank you.
The next item is the approval of our plan of organization for our local public health accreditation review, which is scheduled in October. And we go through this every 3 years, and it's pretty straightforward, relatively speaking, although I know that I don't expect that all of you have looked at the huge amount of documentation associated with the accreditation process. But it is available. If you have questions, we can answer them. So we're looking for an approval and ultimately the signature of the chair of the board for our plan of organization for our next cycle.
Okay. We do have, before we move on to C, and then we'll accept those motion support in just one moment, I just want to clarify in the area of letter B, the health department contract, we had a motion and support, and we need to vote on that still, I believe. So a vote on the area of letter B, the health department contract. We had a motion and support. All in favor? All opposed? Okay, so that motion passed unanimously. Now we're on to C, and I heard a motion and support down there. And Carrie Ann, do you have the? I do. Okay, so we're current on that. So we have a motion and support to authorize the First Amendment to Agreement for Services. Nope, wrong one. I had it clicked on there. Okay. To recommend to the full Board of Commissioners to approve the Health Department's plan of organization and authorize the chair of the board to approve the form. We have a motion support. All in favor say aye. Aye. All opposed? Motion's passed unanimously. All right. Now, thank you. We are on to the Health Department monthly staff report.
Thank you. It has been a very busy and interesting month since I came on board July 15th, and I've tried to kind of capture most of the things that I've been doing. Obviously, learning about how our department works and working with all of my division directors to learn the programs and services. It's not that I'm unfamiliar with them, it's just we do things a little bit differently sometimes from health department to health department and who our partners are in doing things, and so I need to understand that. It will be helpful also to understand that in the context of doing the health integration work that I'm obviously hired to do with Allegiance Health, and I want to make sure that those three things blend together very well. I've met with the Prevention and Community Health Program staff at Allegiance Health, and I'm still meeting with a number of other folks there as well as we figure out exactly how we want to pursue their desires, if you will, for health integration. I know that reducing healthcare costs is a big item in everyone's agenda, and we want to help to do that as well. Learning about the Jackson Health Network, which is really, I think, very progressive, very innovative, and probably really necessary to move in that direction in terms of trying to integrate and maintain a prevention and population-based health focus. It's probably what we've been advocating for in public health for years. So we're glad to see that we're moving in that direction. And then we have a few other things that are coming up. Obviously, you know about Cycle 5, our accreditation program with the state. We had a successful Clinical Laboratory Improvement Act review on July 26 by the state. Just a couple minor deficiencies there that occurred, but we've taken care of that internally with documentation. And our Director of Personal and Preventive Health Services was very helpful in assuring a good review. And just one other piece of information kind of related to West Nile virus. The Michigan Department of Community Health Bureau of Labs confirmed the first human West Nile virus case for 2013, a man from St. Joseph County. We haven't had any cases reported here, and we haven't had any births reported, so been quiet that way. That's my report.
Is that your report? Commissioners, any comments? What questions or comments might you have for Mr. Toon? All right, thank you for that information, and keep up the good work.
Thank you.
Up next on our agenda, I believe we have Marcy with the Department on Aging monthly report.
Good morning.
Good morning.
I just wanted to bring this up on screen, but I'll mention a few things first. Oh, sorry. Medicaid waiver, Meals on Wheels for in-home services for lighthouse cleaning and bathing assistance, and also for Meals on Wheels. We have an agreement with the Area Agency on Aging that when they request those services for their clients that are Medicaid eligible, then they reimburse us at a set rate per hour or per meal. And the meal rate had been $5 a meal for quite a while, so the Hillsdale-Lenawee and I myself asked the area agency if that could be increased. So it has gone from $5 a meal to $6 a meal. So that's good news. Won't make up for the reduction in meals that we're providing through the Medicaid waiver program that we experienced last year, but it's helpful. So every dollar helps. I reported the last couple months that the attendance at the Henrietta Nutrition Site has been 3 people usually, maybe 7 up to once a month. For 3 months, we're trying to see if we can have 10 meals a week provided at that site. So far, we haven't gotten up to even 3 meals a week that it's open on Wednesdays. So we're still in that trial period for 3 months ending September 30th, but it has not gone up to the 10 meals like we had hoped that the exercise class might be interested in getting a cold meal to take with them. So far that has not worked out. So do you have a question?
Marcy.
Yep. In the last couple of years, we've tried to recruit flyers at different local businesses and information to churches, and it's just still been a steady decline. And I've talked with both township boards in that area. And yes. Well, in order to get them in their home, you have to be homebound. And whereas the senior nutrition sites are for people who are more active, and the exercise class there is very active and there's a lot of people, but they're done at 10:30 and they're not interested in staying for lunch at noon. So we offered them a cold meal that they could take with them. And at first they were interested, but the last couple months they haven't. Participants in that class have not been taking what we call a food with friends cold meal with them. It's not our class. So, oh yes, yeah. Yeah. And it's a good thing that people are active in a class, there's a good attendance, and then they're on to their next thing. So that's a good thing, and that's what we're seeing more of in younger adults, age 60 and 70s. So, yeah. And then the final item are grant applications to the Area Agency on Aging. The board approved are applying for the grants. There are cuts, and you have a copy of that in your report. This is a list of the cuts that are issued in the request for proposals. This came to me after the last Human Services Committee meeting. So the grant cuts are federal sequester cuts. For the current grant year, which ends September 30th, the Area Agency on Aging used their local funds to make up this cut, almost $30,000. But for the grant year starting October 1st, we will experience those cuts. So what we did as staff, we looked at the service prioritization that was done earlier this year. This is something that I presented to the Human Services Committee a few months ago. So in considering that, then we looked at what you have is called List 2, and that is a list of budget adjustments that we'll do in order to cut the $25,900 in grant revenue that will be happening once, assuming we receive all the grants that we're applying for. So I just wondered if there's any questions. I mean, we'll cut unmet needs. That's what Caregiver Supplemental Grant, that is what we call unmet needs, which is one-time purchases for people, maybe a hospital bed or a furnace repair, that type of one-type item. So we'll cut that program. And also Lifeline service, we've been paying for Lifeline for, right now we have 12 seniors receiving this. It's $30 a month. It's something that when we talked about senior millage, before senior millage first passed, we did not say we would pay for personal emergency response systems or lifelines. But once the revenue was available, that is something that we started to do, and then we have not added anyone new to that program. It's just gradually, there have been fewer and fewer. So part of our proposed cut, $20 a month, would be to ask the current provider if they would honor that $20 a month to these 12 seniors, but that we would no longer be paying for those 12 seniors, that the seniors or their families would need to pick up that cost. And then reduce the chore repair hours to what the grant will cover instead of, so we would be basically cutting. So because we have less grant money, we have to use more local money to make up some of the difference. So that's why we're just looking at overall cuts. One would be to cut back a little bit on the chore repair person hours, and then to reduce snow removal to what we provided last year. And we had enough set aside for more snow, and we have in mind how many snows we can pay for, and then if it's a light winter, we use that money for lawn mowing. So that's how that works. And then with home care hours, we were trying to get our hours back up, and they are starting to go back up now that our part-time, we have more part-time positions, so our worker turnover has gone down. We would like to get up a little bit more, and we still have enough funding to do that. We just won't be able to get back to the high level that we had at 2011. We just don't have the resources. But we're able to maintain a good amount where we're at right now. So it's not like I'm saying we're cutting what we're providing right now, but we do have a waiting list, and people go on and off the waiting list. They're assigned not first come first serve, but based on need. So if someone has very little supports and they have a lot of medical conditions and are homebound, there's different points that we use during an in-home assessment. So they're assigned a worker first, and bathing gets priority and respite. People who want lighthouse cleaning every other week, depending on their points, they might have high points because they can't do any of the work themselves and they don't have any support. So I'm emphasizing we serve those with need first, but there are people on a waiting list that are waiting to be assigned a worker. Any questions about
Marcy,
the
I was
plan?
wondering, do you have many requests for the assistance with Lifeline? You had mentioned you're not accepting anymore, but do you receive many requests?
No, the referrals primarily came from social workers for clients that were already getting Meals on Wheels or home care services and lived alone, so we have not gotten any more referrals.
Thank you. Commissioners, what questions? Commissioner Rice?
A comment, Marcy. I know making the adjustment cuts had to be difficult, but obviously with the sequestering, it was something you had to do. And I'd just like to comment that as I look at the list here, I have no doubt that you did the best you could with what you were dealt, and I just appreciate your efforts on this, and I just thank you for being proactive with it. Thank you.
Okay, thanks.
Commissioners, anything else? All right, thank you, Marcy.
Thank you.
Next, we have Mary Beth from Lifeways.
Good morning, Commissioners. I'm here to present my monthly report as to what's happening related to activities at Lifeways, primarily related to the counties. We are at a point where we have sent a draft contract for Jackson County to provide the facility and house cleaning support for our Jackson building as well as our group homes in Jackson. So we hope to have that contract finalized soon. We also are in the process of revising, because in Hillsdale County, the Hillsdale County provides the facility support for our Hillsdale building already, but they're going to be expanding that to include our group homes, and we also are in the process of finalizing that contract. Since we talked last, we have had a meeting with the County Sheriff's Office to kind of explore possibilities related to the Child Care Fund, but we're just in the initial meeting stages with that. The other thing that's happening is related to tenant leases. As they come up due, we continue to renegotiate those to allow us to be able to generate the additional local revenue as we are allowed per our contract with the department. We do have a potential long-term tenant from CBRE that we are in discussions about. And in the meantime, we do have a temporary tenant. The Halloween Party City Place is in there for the holiday season. So we do have some revenue that's being generated at this point for that vacant portion of the building. The other thing that we're doing is we're continuing to explore funding options because our note with our bank for that portion of the building has come due, so we are looking at our options related to refinancing and working with First Merit Bank. And the other thing I wanted to give an update on is that you should be receiving soon from the department, because they communicated to us last week, they're sending out their response back related to the local funding issue. So I anticipate that both you and I should be receiving that shortly. And then the other thing I just wanted to let people be aware of is that we are having a ribbon cutting ceremony on Friday. I don't know how many of you are aware of the fact that this has been a long time in planning, probably over a year and a half, 2 years, looking at integrated health, both from the physical health side as well as behavioral health. 2 years ago, we started the process of bringing behavioral health on site at the Center for Family Health, the federally qualified health center here in Jackson. And we have now taken the next step of, okay, let's bring physical health on site for behavioral health, because we know that if we can coordinate services for individuals and address their physical health needs along with their behavioral health needs, that they'll have a longer-term life. Because on average, they have a life expectancy of 25 years younger than most individuals. So we are very excited about that, and it is this Friday at 11 o'clock at Lifeways. The other thing I would like to thank the county for is hosting some of our artwork. It's actually the state artwork, but I don't know if you have one of our local representatives. I haven't seen what you have here in your building, but on the second floor, you're hosting some of the artwork from individuals throughout the state of Michigan who have behavioral health or developmental disabilities, and I would just like to thank you for doing that. I appreciate that.
Commissioners? Commissioner Duckham?
Good morning, Mary Beth.
Good morning.
Are you prepared at this time to state or can you talk about it, the value of the contract with the county for facility support and housekeeping?
I don't have that number. I know that it's in the process of, Gerard had drafted a contract with the items and had sent it on to Rick here at the county. And the numbers, I don't know that we have an exact number at this point in time.
Okay, any idea about where we're at on this?
We're hoping that we'll have a contract finalized, at least something to be presented to your board by next month. Our board has already approved us to go ahead and proceed with the negotiations for this contract.
All right, thank you.
Any other comments, questions? Commissioner Rice? Commissioner Lechko?
The group home cleaning and maintenance, that's something brand new?
For Hillsdale County, no. We always provide that service for the homes that Lifeways owns, not all group homes in the county. It's just a few we have a few homes that Lifeways owns.
Okay, so that's not an additional expense or area that's not been covered before?
No, it has always been our responsibility to cover that. We're just now in the process of looking at contracting for Hillsdale to provide that and for Jackson to cover that as well.
Commissioner Rice?
Not to speak on numbers, but at least from my perspective, the facilities maintenance contract agreement that's being worked through, for me anyway, I would say that if this occurs, it would be a win-win situation for Jackson County and Lifeways.
Mm-hmm.
And I do have another question for Mary Beth.
Yes.
Each month we get a report, and the report talks about how Lifeways has had several discussions with the department, Michigan Department of Community Health, which I realize you are having those discussions. And we keep hearing that we're going to get something back in return in regards to the county appropriations. I realize it's out of your control as far as when they're going to do this, but from my understanding, there already is an answer to this. I just wonder why they can't provide it.
There was or was not, I'm sorry, could you repeat that? I didn't understand your last part of that question, I'm sorry.
From my understanding, when it comes to the information or the understanding from the Michigan Department of Community Health, my understanding that their research of the mental health code and everything else that they've looked at, my understanding is that there is already an answer to the county appropriation, the amount. So I'm just wondering why they can't just provide that to us.
That is what I understand that they're going to be doing as of our last conference call with them last week. There was a lot of, they've lost staff at the Department of Community Health that used to oversee this. So there was a lot of trying to go back into records to find out what precedent had been set prior related to county's obligations related to appropriations, and also for us to look at some of our information. So it did take a little bit of time of conference calls back and forth with information that they were able to obtain and information that they had requested from us. So, I do apologize. It is outside of my control when they're sending it, but I did get an agreement from them last week that they would be sending that out. So.
Okay, thank you.
Yeah.
Commissioners, any other comments, questions? Commissioner Shotwell?
Mary Beth, I want to thank you for sticking with us through this last year and a half. I know that it has been an effort, and I really appreciate your hard work and time spent with both boards, this one as well as the Lifeways Board, and I want to thank you.
Well, thank you. I appreciate your efforts as well. I do feel that while this has been a difficult and challenging issue, it has been an issue that has built relations with Lifeways in both counties that I don't believe was necessary in place prior. So thank you.
Very well said. Anyone else? All right, thank you, Mary Beth.
Thank you.
On our agenda, we have the RSVP Retired and Senior Volunteer Program Annual Report. I don't see anyone from that department. That is in the packet for your review. We also have the Medical Care Facilities June financial statement. That is there for your review also. Next up, we have the MSHDA, CAA, and County CDBG agreement. Do we have anyone here to discuss that? Mr. Brown?
This came from Toby Berry, the CEO at CAA, the Community Action Agency. We receive a community development block grant each year of about $300,000. We don't really have the expertise in-house to administer that, and so it's been an efficient way to deliver that service by working with Community Action Agency. So MISTA, the Michigan State Housing Development Authority, requires an agreement to receive the $300,000. They require an agreement to have a third-party administrator, which is Community Action Agency. And then there's a signature form that needs approval that allows the finance officer and myself to work with CAA and do the necessary documentation. So that's what's before you.
All right, thank you. So I'm looking for a motion to approve the agreement and send to the full board.
So moved.
A motion in support. All in favor? Aye. All opposed? A motion unanimously passed to move to the full board. Next, we have claims. A motion in support to pay the claims. All in favor, say aye.
Aye.
Opposed? Motion passed unanimously. Under other minutes, we have the DHS board meeting minutes from June. And we have our September reporting schedule. In September, we will hear from Department on Aging, Health Department, Lifeways, DHS, Medical Care Facility, and MSU Extension. Moving on to public comment. Is there any public that would like to express an opinion? Any committee member or commissioner comments? Yes, Commissioner Mahoney. Thank you. Any other comments, questions? All right. With that, I believe we will adjourn to the call of the chair.